This is the worst condition our hospitals have seen likely ever.
Normal hospital operations may soon no longer be a reality.
Imagine you come to the ED. This could be for a heart attack, a stroke, any sort of condition with an injury, and then you come into a waiting room with 40 plus people. You wait for 6 hours. Then you get pulled into the back of the emergency department. You're put in a hallway bed, and you often stay there for 24 hours. And not only that, but you are there with 10, 20, 30, 40 people that are also waiting for beds.
Hospitals are overwhelmed right now in Jackson and Josephine counties, more so here than anywhere else in the state. Providence is looking at their hospitals in Spokane and in the Bay Area for more beds, and may potentially put beds in their conference rooms. Asante is also looking at all options on the table.
If you come to our hospital for any reason, we might not be able to help you. We're out of beds, our staff are stretched, and we have limited resources.
Asante has already had to deny over 200 patients for regional referral because it's at capacity. Over 350 surgeries have been canceled for people that could be in pain or needing life-saving treatment.
Imagine that you're a patient sitting with your physician, and the physician says to you, you have cancer, or you have heart disease, or you have stroke symptoms, and you need surgery. And in a world before, you would have gotten that surgery in days. And now you're being told we can't accommodate you.
Medical staff are also being pushed to the brink.
Our staff are exhausted. They're working extra shifts to cover these beds, going well beyond their normal patient to nurse ratios, again, because we're forced to do so.
Providence Medford Medical Center says its emergency department is bursting at the seams. For a hospital its size, it's breaking records.
Our COVID numbers here at Providence are larger or more than what we're seeing up in our largest hospital in Portland, up at St. Vincent's.
On July 6th, there were 12 COVID-19 patients hospitalized in Jackson and Josephine County. Thursday, that number is 149.
Jackson County houses about 10% of the state's population, and we have about 30% of the COVID-positive individuals in the county.
The vast majority of those hospitalized are unvaccinated and have the highly contagious Delta variant. It's far more transmissible than previous COVID strains that shut down much of the country last year. In Jackson County, 48% of the total population is vaccinated. In Josephine County, the number is less than 43%.
We're doing everything we can to respond to this increase in cases, but it's really up to the community as to how this is going to end.